I'm Ashley Montgomery Yates, and I am a physician in the Division of Pulmonary and Critical Care Medicine, and I'm also the CMO for inpatient services and emergency services and involved in our vaccine rollout. To register for a vaccine as a member of the public, you go to our website, which is ukvaccine.org. There you'll find lots of information about the vaccine and a big yellow button that you click to register. You go to a form and enter all sorts of information about yourself.
My name is Philip Allmeter. I'm a pharmacist. I oversee pharmacy services for UK Healthcare. First of all, we designed the form so that you don't have to come on site and fill out a piece of paper. Just as if you were coming on site with a loved one, you had to fill out the form for them in person with paper, you can do this online. There's nothing particularly complicated with what we're asking. Name, date of birth, email. Email is important because that's one of the ways we're communicating you're next. And then there's some standard questions that the state's asking us to collect, like race, ethnicity. There's some other information such as your social security number that we're using for data collection purposes so that we can match up our records with the state. Because when we do these vaccinations, we submit all of this data to the state and the state to the federal groups that are overseeing this process to make sure that we're vaccinating at the rate that they would like us to do.
The form online can be filled out by anyone. We use several data points to identify you as a unique individual, and if too many of those data points match, then you'd be removed. But in general, if you have a parent who is not very internet savvy or someone who perhaps doesn't speak English as their first language, then you can absolutely assist them. We're assisting many of our patients in clinic, and we have a phone number where you can call and ask for assistance in filling out the form over the phone. You can communicate with that person via the telephone, and they'll actually fill out the form for you sitting in their computer. So anybody can help anyone fill out the form. In order to comply with the CDC and state guidance, we need to choose to invite the people who are at the highest risk groups first. We obviously cannot vaccinate the entire state in a week. We just don't have the resources or the numbers of vaccine. And so we want to make sure that we're getting that vaccine out to the people who need it the most. The elderly, the folks in the healthcare systems, and the folks working in our school system so that our kids can all get back to school. And in order to ensure that those folks go first, we've used an access code to allow access to the scheduling system.
So after you fill out our online form at ukvaccine.org, after we evaluate where you fall in the phase, you can be invited to receive a vaccine. With that invite, we have set up a sign-up page on signupgenius.com. We use an access code to limit anybody getting access to the vaccine because this is a federal funded program. We can't give it to anybody who wants it. We have to go through the CDC and state recommendations on who should get it first. The access code is meant to limit everybody having access to it at once. We are improving the process, and we anticipate not needing an access code because there have been some that have shared it on social media, and this is not getting access to the vaccine for people who are jumping in line. If you find a way to get the access code but you haven't been invited, we know this, and if you show up to be vaccinated, you'll be turned away. So it's there, and it's intended to help us prioritize access.
If you share your access code, you will be allowed to go in and schedule in Sign Up Genius. However, you will not receive a vaccine. We are very aware of who has been invited, and when you show up at the vaccine center, you're going to be turned away because we're going to know that you were not invited. You have to present identification when you come to the access center, either a driver's license or some sort of a utility bill or a school ID or whatever it is that you have, but it has to match that information. And so we'll know you're not invited and you're going to be turned away. We're calling people sometimes. We're trying to remove folks from the scheduling software. The problem is now we have so many people who've shared the access code that those folks have sort of jammed the system, and the folks who really need to get the vaccine vaccine can't get slots. And so we're having to sort of work behind the scenes and spend a lot of energy that we would like to spend getting more people vaccinated, cleaning up the mess that's sort of occurring because people are sharing the access code. So we ask you, please don't. It's not going to wind up getting you what you hope, which is a vaccine sooner. It's only going to create more difficulty for those really trying hard to provide vaccine to the most Kentuckians that we possibly can.
We have about 96,000 people who are registered. That's great. That gives us a pool to select from. Based on how you fill out that questionnaire on the form, we can match your demographics to the recommended phases that the state and CDC have put out. It's pretty straightforward. We designed the form to match the phases. On a rolling basis, when we have opening slots, we're sending out more invites, and we prioritize by phase 1A, then 1B, 1C, and below. So far, we've mainly been in 1A and 1B, but we'll be entering the 1C phase in the near future. And when we do, it's a rolling basis, and it's not a completely clear cut line between 1A, 1B, and 1C. And by that I mean, if you have so many slots open and you've already filled up all your 1As and 1Bs for that day, then maybe 1Cs get invited. But then maybe next week you have more 1A and 1Bs registered that weren't in there before. They could fill up most of the slots and not as many 1Cs. But by continually looking at the process and prioritizing based on the state and CDC recommendations, we're able to keep the process rather efficient. It varies, and it's going to vary based on your phase. I encourage every citizen in Kentucky who wants the vaccine to look at the phases recommended by the state. It can answer a lot of questions for you. But what the citizens of Kentucky, especially those who are registering for UK sites, should know is that we are prioritizing based on that chart. And as soon as we get through, we saturate 1A, 1B, you'll see us going to 1C and below. And we are not withholding vaccine. As soon as we get that vaccine, we want to give it to the citizens of Kentucky who want it.
So if you're a 70-year-old, we would suspect that we will get you in the next 3 to 4 weeks. If you're a healthy 40-year-old, it may be April or May before you get an invitation. And that is just based upon the number of vaccines that we're getting. If that number changes, if we have multiple centers, if the center expands, all of those pieces we can't necessarily predict right now. But that's why we also think it's super important that wherever you have the availability of a vaccine, you should go get it.
I just encourage our patients to be patient with the process and check their emails for invites when that time comes.